and pleasure to introduce our fantastic speaker, who I think has 2, 3, 4 full-time jobs. She can let you guys know how many full-time jobs she has. There are my dogs in the background. They're so excited, singing Shiva's praises. I try to keep my concentration. She's a 6-term alder with the city council, just coming off being the council president. She also is a chief diversity officer for UW Health and has held that position for the last 4 years. She's on countless committees and just an incredible leader in our city, has done so much to help our community downtown and DMI itself, particularly in the creation of this committee. So we're always thankful for what Alder Bidar does for our city. So without further ado, the stage is yours, and we'll begin.
Thank you so much. Let me make sure I can bring my screen up. Okay, I think it should be working. I see a thumbs up. So thank you so much for the introduction, and thank you for to all of you who are joining today for this important conversation. I see through the names some of my amazing co-workers and also colleagues on the front line of serving our communities as we have seen the impact of COVID-19 over the past 8 weeks. I'm joining you from my office here at UW Health, where I think I can safely say we've been really at the center of a lot of the work and discussion around COVID-19, and particularly in my world around the discussion about the impacts of COVID-19 on our communities of color, which is the subject of our conversation today. As Jason mentioned, I would like to talk for about 20 minutes, which I know for some of you, again, it's hard to believe that somebody that sits on the city council can stick to 20 minutes. But I will do my very best to stick to 20 or 25 minutes and then open it up really for questions and discussion around this topic. So the first thing that I want to start by saying is that I decided to title this presentation, COVID-19 Shining the Light on Racism. And the reason that I decided to do that is because although there's been a lot of conversation around all COVID-19, there is disparities in COVID-19 and how it's impacting the communities of color. It really, all it's done for those of us who have done this work around disparities and racism is really just shine the light in a way that maybe wasn't very obvious. I think the world and our country generally. So structural racism has always been a pre-existing condition in our country. And certainly COVID-19 has shined the light on the existence of this pre-existing condition that is racism in our country. So let me talk a little bit about data first, so that we can all really have the data that can confirm really the enormity of the disparities of COVID-19 cases and death right here in Wisconsin. Right now, as of the 19th, so 2 days ago, 39% of our deaths in COVID-19 in the state of Wisconsin have been African-American. 20% of the cases have been African-American. You can see on the side that that certainly does not represent it's a disparity compared to the percentage of population. And then if you look at the Latinx and community, 31% of the cases in Wisconsin as of the 19th of May are Latinx, and about 9% of the deaths are Latinx. Let me give you a little bit of the data right here closer to us in Dane County. So Dane County, as of yesterday, we had 556 cases of COVID-19. 16.8% of those cases are African-American, 10.8% Latinx, and of the 26 deaths that we have, 11.5% of those deaths are African-American. So again, a disparity even right here in Dane County, although I have to say that compared to the magnitude of the disparities in the state of Wisconsin and across the country, we have been able to have lower disparities in Dane County. But that said, again, still a pretty significant disparity. I would be remiss not to mention also that across the country, our Native American communities have also been disproportionately impacted by the cases of COVID-19 and the deaths. And I think many of you have probably read and seen in the news that specifically the Navajo community has been highly impacted by COVID-19. So the last impact of COVID-19 is also the rise of just xenophobia, hate, and racism in just public discourse and non-public discourse. So again, headline from news right here in Madison was the racist graffitis against our Asian community and the type of racial discourse that has been used across the country by many against our Asian community. One other context that I wanted to make sure to talk about is, and this is, you know, I've been given the platform, so I'm using it for an issue that's very dear to my heart and my work. I'm also the co-chair of the Latino Health Council and serve on the Latino Consortium for Action, which is a collaboration of Latinx-led organizations. So one of our biggest impact that we see and disparities that we see is also about our undocumented immigrant community, and specifically because of lack of access to some of the relief funds and also programs that are federally funded programs for which this community does not qualify for, including oftentimes children who are US born of undocumented parents. And then let's not forget that before COVID-19 was upon us, we were seeing already the incredible impact of detention of minors and of adults in the immigration detention system. And as we have been talking about how in congregate type of housing, so whether it's in jails, prisons, and homeless shelter, in the ICE detention center, the impact of COVID-19 has also been very much felt. So because the chances of spread of the virus is oftentimes much higher in these kind of settings. So now let me move to talking about why this is happening. I think, again, sometimes people are saying, you know, oh, you know, COVID-19, it's a virus, anybody can get it. Well, that's true, but some are more at risk of getting it than others. And again, it goes to the impact that our structures are having on people. So it's not about the virus, it's about the environment and the society that we've built that makes some people more vulnerable to COVID-19. So I wanted to specifically talk about some of those issues. One is certainly there is an overrepresentation of people of color in essential jobs. It's been really interesting to me, by the way, to see how our language in some ways has changed, and now we call those jobs essential jobs. Well, I'm glad that we call them essential jobs, and I hope that we can continue using that kind of term, and also make sure that we're providing the support and the pay that people deserve that are in those essential jobs, right? So essential jobs have oftentimes been the people that work in the grocery store, that work in certain parts of our industries, such as cleaning. You know, as somebody that works in the hospital, I know a lot of conversation happens around our heroes that are our clinical providers, which are my colleagues and my heroes too. But behind every one of those heroes are a whole bunch of other heroes who are right behind us, cleaning our offices, cleaning our OR rooms, cleaning our patient rooms, and making sure that everybody is safe. So again, we do see that we have a representation, much higher representation of people of color in those kind of jobs. So these are also at the same time jobs in which there has been a disproportionate number of cases of COVID-19. And part of the reason is, one, people are not sitting at home by going to those jobs, so they're exposing themselves just by nature more. And two, those kind of job environments, many of those jobs do not allow for this physical distancing or social distancing that we all been talking about. So if you work in a factory, you work in a dairy farm, you work in a meat packing factory industry, social distancing is very, very difficult. So again, disproportionate impact due to the type of job and social environments. Then we have another reason for the impact too, which is the unequal distribution of wealth and unemployment. So again, because people who are at the lower wage and because of the racialized wealth gap in our country, those individuals happen to be more exposed because they have to continue to work. They have very little opportunity to stay at home and be able to stay without a job for a period of time because the savings and the amount of wealth are not allowing them to be able to do that. So again, fewer resources. The lack of safe and affordable housing and community resources is another part of the racialized impact. So many families in communities of color live in multifamily housing, in rental housing. Again, even here, right here in the city of Madison, we see that the proportion of our communities of color that are renters is much, much higher than our white residents. So again, it's much easier to be able to social distance or physical distance when you're living in your single family home with a kind of yard and space than when you live in apartment buildings. And then, of course, we have our residents also who are suffering from housing insecurity and homelessness. And again, overrepresentation of people of color within our homeless community. And the impact there of families that are homeless has also been huge. The city and the county have done a lot of work in trying to maintain safety from the spread of COVID-19 for our homeless folks and families. But again, their risk continues to be high for those communities. Access to necessities. Things that maybe some take for granted, which is the ability to be able to pay for delivery services or to not have to go out as often to shop because you can actually go once and fill your needs for 2-3 weeks at a time because you have that amount of cash available to you to be able to go to the grocery store once every 2 weeks. But for, again, many of our families that suffer from this kind of racialized wealth gap, that is not a possibility, which means, again, more frequent outings, inability to leave the kids at home. I've heard a lot of comments, people saying, well, I went to the grocery store and this family was there with 4 kids and they should just come shop by themselves, not bring all the 4 kids. And I think ideally, I'm pretty sure that mom also would prefer not to go to the grocery store with 4 kids. But the reality is that if you don't have anybody else and you don't have the ability to have the support system to leave your kids with, you're going to have to go to the grocery store with your 4 kids. Things like the use of EBT, which is for food share, also has been limited. Public transportation has been limited during these times of COVID-19, which again limits also access to resources. Number of other, again, impacts that we've seen, lack of access to quality healthcare and health insurance. Again, our numbers of uninsured in Dane County are pretty low, so we're lucky that way in Dane County. But when you drill down into the numbers, the highest number of uninsured are amongst our Latinx community. And also the highest number of uninsured are amongst those who are in the service industry. So there are two at-risk populations there. And then lack of insurance certainly prevents people from seeking treatment oftentimes earlier, and therefore have better outcomes possibly for their care. We also know that as somebody that works in the healthcare system, that just like any other system, there is bias and racism within our own systems. We have been certainly working diligently in eliminating those biases and racism within healthcare system, but they exist. There have been many stories nationally and in the state of Wisconsin about people seeking care from communities of color and not being able to get the care that they need in the way and in the with the speed that they should have received their care. So that is just always present in certainly my mind and in the work that we do in healthcare. Then barriers to education and consistent critical information. That has also impacted many in our communities. So one of the messages that I heard early on during the first phase of our confronting COVID-19 in our community was that there wasn't really good messaging that was culturally, linguistically, and racially really concordant, racially, culturally, and linguistically appropriate for communities of color here in Dane County. And that a lot of the messages that were being given to the broader community maybe were not coming from trusted sources within communities of colors themselves. It's important to know that in communities of color, trust is a huge issue for us. And the reason it's a huge issue is because trust has been broken many times. And therefore, having information that comes from really trusted sources in a linguistically, culturally, and racially relevant and concordant way is very important. So a lot of work, I can say, I've tried to do as much of that work, for example, here at UW Health around that, but again, important to point out that generally speaking, there just needs to be more attention given to how we give information and how critical it is to really involve the communities, have the information be from and by the community. And I know that Urban Triage and the Dane County collaboration of Black service providers also has been doing a lot of great PSAs lately that are like really amazing and kind of focused to be from and by the community. But the other ways also of information is that we've gone to really very quickly to a digital age that is now what we had multiplied by a bazillion times. And of course, we have talked about the digital divide also in this country for a long time. Well, we are now living that digital divide. We know, for example, that for the school system, as they've gone in ways of doing their teaching and classroom remotely, that there is a divide. Of course, for example, MMSD has worked very diligently and hard in trying to make sure that all families have access to being able to get on the internet and being able to access it. But again, still a gap that we need to deal with in digital infrastructure and access. And then lastly, pre-existing health conditions. As I told you, racism is certainly one of them. It's a pre-existing health condition in this country. But we also know that because of all the actual issues that I just talked to you, that in our communities of color, we have a lot of what we would call in healthcare comorbidities or additional conditions that really make our communities more at risk for having worse outcomes when it comes to serious illnesses such as COVID-19. So I want to take you to take a second to certainly look at this great quote, because I think for me, it really does a very good job of summarizing the issues that I talked about. But what I particularly liked about it is that it says, Dr. Cameron Johns says, this is the time to name racism as the cause of all of those things. And in local healthcare systems or across the country, we have been talking for a long time about, and in public health circles across the country, about racism being a public health crisis. And those were words that we used before COVID-19. We were often talking about how racism is really a public health crisis. There actually, for example, there is a Wisconsin Public Health Association statement and declaration that all the local health systems have signed, including, in addition, Public Health Madison, Dane County, and the school district, and United Way. But we were doing that a year ago, and now we've seen it. Racism is a public health crisis because we are in a public health crisis where we have seen racism play out in the numbers and the disparities that we're seeing. So I know oftentimes the next thing that comes to all of our minds is, okay, now that seemed like a lot of information about the things that are going on that are not okay. And so what can I do? So I wanted to next talk to you a bit about my ideas of things that you can do. So first, 3 things that you can do. At the individual level, I think we all need to take responsibility for what's right before us, which is the clear shining of the light on racism in this country that COVID-19 has brought to light. So let's take responsibility for it, and on an individual level, do the work that we need to do to really examine our own biases, our own behaviors, and our own actions within our own community that again, those are directly our own span of control. The next thing that we need to do is to really think about, as institutions and organizations that we work in or for, what can we do? So really looking at our policies and practices and procedures within our organizations, and who are they benefiting and who are they not benefiting? Those could include things that are have to do with pay, leaves of absences, ability to cover this kind of loss of income for those in organizations that make the least within an organization. What kind of equity practices are we building within our own organizations and institutions? And then last but not least, really thinking about how all of those things work together to create this structural racism. Individual, organizational, institutional biases all come together with these structural biases. So how can we invest and take this opportunity to really think about how we innovate and disrupt the systems that we have built and the structural bias. I was on a call earlier today where the talk was about how COVID-19 has created an opportunity for us to innovate and disrupt. We have done things, created new ways of doing things faster than we could ever have thought about being able to do those things before, because we had no choice. We had to be able to start meeting remotely. We had to be able to provide, let's say, telemedicine to individuals. So we had to be able to create safe living spaces for our homeless community very quickly. We had to do things very quickly, and we have been able to successfully do that, right? So we have been able to innovate and disrupt under this situation of stress and need. And so if we are able to do that, then we are able to also innovate and disrupt racism, innovate and as a community around what we do, and therefore disrupt racism and the patterns of racism that have existed. Because before COVID-19, and this is what I know this sounds like a little strange to say, but I see COVID-19 as having created this opportunity for us, right? Because before there was always this excuse that, oh my God, but racism, it's been built over, hundreds of years, and how can I disrupt it? How can I change it? And it's like, wow, well, within 8 weeks, we've disrupted every way that we were doing anything within the city of Madison. And so if we can do that, if we can reinvent ourselves in such amazing ways, there is no reason that we cannot also disrupt racism if we choose to do it. Because we chose to do all of those other things. We chose to know that we needed to be able to have different ways of providing services or different ways of functioning as a city, that we couldn't just close down, right? We couldn't just say, oh it's too complicated, we're not gonna be able to do it, let's just not do it. No, we said we need to do it, we have to do it, we'll do it. So let's think about how do we do that around racism too? And we just say we have to do it and we will do it. So I will end with my last slide, which is one of the ways of doing it. And this, for those of you who've heard in me before, I will use every platform that I have to say it again, is trust and invest in our leaders of color. We have amazing leadership of color and organizations that are led by people of color in our community. I know a number of them because I saw their names where I have joined us. Shout out to Karen Menendez-Collier from Centro Hispano, to Veronica Figueroa from Unidos, to my many, friends and amazing community leaders that are part of all the organizations that you see on this screen. But there is two amazing collaborations of organizations that are really led by people of color and doing work on the ground. One is the Latino Consortium for Action, and the other one is the Dane County collaboration of Black service providers. Invest in their work. They are the ones that are on the ground doing by and from the communities. And then I put a couple other ones, Freedom Inc. and the Monk Institute. There are many others. This is not an exhaustive list. I want to put it out there. So please, if you're my friend and you didn't see your name up there, it's not out of not wanting to have you up there. Please continue being my friend. But these were, for me, top of mind, especially because I've seen amazing collaborations that have formed. And I want to make sure that we understand that these are by and from the community and need our investments and our support so that they can do the work. They know better. We know better. And so continue investing in these organizations. So with that, I'll leave you with my quote for the day, which is, we keep hearing this is the new normal, right? The new normal is going to be different. Our new normal is going to be about physical distancing. And so as I was thinking about how we are now using this term, the new normal, let's make the new normal be an anti-racist normal. That should also be part of the new normal, and we all have a role to play in creating that new normal. So I will open it up now to certainly questions. I'll stop sharing because you don't need to see my tree for a long time, but I love my tree. So we can open to questions. I did stick to kind of 25 minutes, didn't I?
No, you did it. Honestly, Alder, it was a fantastic discussion and so many important topics there. And thank you very much for that quote at the end. It was, that's inspirational. And I don't like to say we want to recover. We want to reimagine or restart what we actually want. We don't need to go back to the mistakes that we made, the policies that were poor from the get-go. So it's about restarting and reimagining. So thank you very much for ending on that. Our first question of the day is going to come from Doug Poland, the chair of our organization. And Doug, you're up.
Thanks very much, Jason. Alder Bidar, thanks so much for being here today. Thank you also for all the work that you have done in helping us to start the Inclusiveness Committee at DMI, really launch this work. Imagine what it was going to be. Your work was really fundamental to being able to form the Inclusiveness Committee, so thank you. I wanted to kick off by saying I think that COVID-19 also has impacted or has created disparate impacts in ways that we don't necessarily realize. I was involved quite heavily in litigation over the April 7th election. One of the things that we found, I represented a number of Get Out the Vote groups, advocacy groups, voting rights groups, and civil rights groups. And one thing we found was a tremendously disproportionate impact on African Americans, Latinos, and also lower income people, mostly in the larger cities. And so when we talk about institutional and structural racism and dismantling those barriers, we have to look at voting in elections as well. You can only elect people who look like you and advocate for your policies if you can get to the polls and actually cast your vote. Yeah. And that didn't happen in the way that it should have on April 7th. And so I would encourage all of us to think about the various ways in which, in addition to the fairly exhaustive list I think that Shiva gave us, to think about the things that we see too. And as we come up in an election season, both in August and then in November, there is going to be a lot of debate about different methods of voting, by mail or in person, different things to do. And I would encourage everyone, to the extent that they're discussing it or thinking about it, or are in a position to do something about it, they think about maximizing opportunities for Wisconsin residents to be able to exercise their right to vote. Doesn't matter which party they vote for. We want people to be able to vote and who are eligible to vote. So again, Alder Bidar, thanks so much for your work in this area. I really appreciate it.
Doug, thank you so much for raising that issue. Another one of those that are close to my heart. But you know, as you just well described, I think there is a oftentimes when we sit in and for those of you who know me, I'm going to be very direct. But we sit sometimes in our roles of our places of privilege. So a lot of people have been saying, well, we should just do mail-in ballots. Just send everybody their ballots by mail and they'll vote. And that's just the easiest. Why let's move to that. And that seems easy when you have access to regular mail. You actually, you know, have access to then just sit at your table and, you know, do your thing and then put it back in the mail and all works really great. And your life is just, you know, kind of that kind of life. But we, for example, know that mailing ballots actually can create a lot of inequities and disparities for communities. So again, I'm not saying that I'm not even saying we shouldn't have that. Clearly that's an option. But when we think about let's just have one way of doing things and not multiple ways of doing it so that we have an equity. Different people need different things. Then we end up really actually creating a disparate impact. So, so I think a really important issue that you mentioned there.
Thank you, Doug, and thank you, Shiva. We've got a question now from Ron Luskin. In your capacity with the City Council, what sectors of the local economy can be activated to help bring jobs back to marginalized communities and people of color?
All sectors of the local economy, I think. I don't know what sectors I would say, really. I think, you know, our communities of colors need to be in all sectors of our economy. So I would say all of them. I wouldn't want to pick one and not the other, but certainly we know that the hospitality industry, the service industry, there is an enormous number of employees in those industries that are part of our communities of color. A lot of our Latinx community works in those industries. But again, I think it's all of the industries are really critical to communities of color as they are to the rest of the economy of our city. Small businesses, again, in communities of color are essential in the ecosystem of well, very important everywhere, but in communities of color, small businesses are really part of some of the best ways for people to be able to actually bridge the wealth gap is because Oftentimes that doesn't happen in other ways than when a person of color kind of creates their own business. And so, again, small businesses that are owned by people of color and getting the support that they need to get back up and running are really important. And by the way, I just want to put a plug that for me, nonprofits are also small businesses.
Well, thank you for those words. Actually, we were just on a call with Deputy Mayor Arantia and Camille Carter from the Black Chamber and Jessica from the Latino Chamber, and they were very thankful for the leadership that the city has given to make sure that those small businesses really have the resources that they need to not only survive right now, but to thrive. So thank you. Our next question is from the Inclusiveness Committee Chair, Mark Richardson. Mark, you're up.
Great, thanks. Thank you, Shiva, for your presentation. I'm a little surprised that you did it in 20 to 25 minutes. Well done. Question for you. You mentioned that this disruption, right? That this has allowed us, or it should allow us to innovate because we've had to. Along those lines, if we stayed in that mode and we continue to innovate, what would you like to see in a year from now? What things could you or would you like to see Dane County being in a position to do, Madison included?
If I think about the innovation part of it,
Yeah.
One, I would like us to have clearly overcome the digital divide in our county and make sure that everybody really has access to both the physical technology, your laptop, your computer, whatever, tablet, any of those, but also the infrastructure around it. So that would be one, because I don't think that there is a way to really continue and move forward without that infrastructure being in place and access to that infrastructure by everybody. So that would be one. And the second one is that I would want to see truly an investment in our communities of color, a real investment, not here's $10,000 and here's $5,000, but the millions of dollars. It seems every day that I'm reading like $25 million for this and $30 million for that. And then I'm working in the community at the front line with many of the people that are on this call, and we're like struggling for $5,000 and for $10,000 and $30,000. So how do we actually really use all of the resources and funding that are being made available to over-invest, and I'm going to say it, to over-address, yes, it's redistribution. You can call me whatever you want, but it is redistribution of the wealth into the communities of color, because that is disruption. That is true disruption. Little incremental things are not disruption. They're comfort zones. So how can we do that? How can we like really in the millions? And again, I said back, let the organization led by people of color lead. I don't know. Those are top of mind. Not sure that was responsive, but.
Sure it was. Appreciate that.
Other questions?
Uh-oh, I think we might have lost Jason.
I know, I think Jason froze. Is that it, right? Oh,
He never sits still. He never sits still for that long.
I promise you, I was not sitting still for
I was gonna start singing Frozen, but you don't want to.
Oh, let it go. Okay. A follow-up question to that is about, it's important to get resources right directly to the communities. And Jessica has really done a great job. And we have weekly meetings with, Jessica from the Latino Chamber of Commerce has done a great job of highlighting that in a weekly meeting that many of us economic development leaders have with the city of Madison, with the chamber, with the Black Chamber, with Dane by Local. And at one point early on in COVID, she said that about 75% of her members were not eligible for any SBA funding. And that was when the PPP was the big, or EIDL was the big barrier. She then brought up, that 80% of her businesses were probably going to fail if this Safer at Home lasted for 3 months. So what do we do structurally to make sure that those resources actually are getting in the hands of groups like the Latino Chamber or in Karen's hands or whoever's hands they need to be in, so that we're making sure that all of our businesses, and in particular our small local businesses, succeed?
Well, you get it into, you do exactly what you said. You get it into the hands of the people that know and are working with those communities. So for the small businesses, the Latino Chamber, for other needs in the community, to the hands again of in the Latino community, to the Latino Consortium for Action and the because it's a very organized group of Latino-led organizations that know exactly what's needed and who needs what, right? So you get it, getting it into their hands and stop micromanaging that, right? Get it into the hands of the organizations that are led and doing the work, and let those organizations do their job. And instead of trying to micromanage that process, so that's what should be happening. I feel, and the other thing is like, be advocates all the time, because I feel like oftentimes we people maybe on social media or when there is a need to go to the Capitol and walk around the square, they're like, oh yeah, immigrant community, we're behind you, and then we mentioned that we're raising funds for undocumented individual, and immediately you get people saying, yeah, no, I'm not sure, like we want to go on record undocumented, can you not say that? And it's like, no, we're saying it because we want to actually say it. And so I think we're going to actually back to the individual part of your action list that I talked about, the individual level. We need to really stand up and do it all the time, and do the same with your organizations. If somebody within an organization say, yeah, I'm not very comfortable giving money to a group that says they're serving undocumented, question that. Ask the question, is this, why? And so I would do both things. But again, giving them money and then letting those organizations decide what they do and not micromanage those processes is really critical.
Thank you very much. So I've got all my questions from the group answered. So we'd love to either to put those questions into the Zoom feature or raise your hand. And it looks like Mark already raised his hand. You're fast. Mark, you're up. But if you have more questions, please put them through the chat or raise your hand and we'll get you next. Mark, you're up.
Well, I actually wasn't raising my hand. I was using the clapping feature because I really appreciated the questioning why, right? And I think I'll just sort of echo what Shiva said is, I think, and I don't know who it was that said, I used to not like the saying, but never waste a. You feel kind of like, well, that's weird to say, but shouldn't we be questioning everything? Shouldn't we be questioning everything? And not just from a disparities standpoint, but from a business model, right? We should be questioning all models at this point, because this has afforded us the chance to do something better, right? And so and that's not meant to be preachy. It's just a better way. We should always be looking for a better way.
Yep. Any other question? Or maybe I can ask if there are any of, I know you're there because I'm seeing you, but any of the heroes and warriors in the communities of color that are on, if you want to chime in and also share your thoughts on this topic, you're certainly welcome. I'm handing the platform to you. So please, if there are things that I didn't cover or didn't say and that you feel you should chime in and say, please do.
Actually, Brenda Gonzalez has a question, which is a perfect segue. Brenda, do you want?
Absolutely. Hi, everyone. So nice to see beautiful faces. I'm not going to take too much time because I get the privilege to share spaces with Shiva. So I'm glad for that. But I wonder if you can talk a little bit more about the equity lens or the diversity, equity, and inclusion that all of our organizations that are part of the DMI could implement. So it's not something that is a presentation, a training, or something that you have to add because of something, but is something that it is within our processes.
Thank you, Brenda, and thank you for your question. So yes, as Brenda mentioned, you know, we talk a lot about using an equity lens, and sometimes I think it can be a little bit overwhelming and feel like, oh, like, what is it that I need to do? And certainly you can dig a lot deeper and understand this equity lens a lot more, and there are many amazing people who can do more training and give information around this to any organization. But I would say basically you can sit around and ask yourself, who is the most impacted by any decision that you take, and is it positive or negative impact? And if you just ask yourself that question, who is most impacted, and positively or negatively, stop 3 times a day and think about your decision and ask yourself that question. And if your answer continues to be the same people are positively impacted, and oh, I hadn't thought, I don't know if that the communities of color are positively or negatively impacted, or oh, I should, you know, it goes back to, you know, Doug brought it up, who would be positively and negatively impacted by any process that we put in place around like changing voting processes. Let's keep asking ourselves that question over and over, and you will find yourself thinking more and more about the equity in your decision making. So that would be one basic question that you can ask yourself. I ask myself every day in the morning, who can I positively impact today? And at the end of the day, who was most impacted by my decisions today? And sometimes I'm proud and sometimes not so. And then I wake up the next morning saying, I'm going to do better.
That's a wonderful way to start the morning. We have a question from your colleague at UW Health, Danielle Camps, wondering if Shiva could speak to the work UW Health is doing to address disparities within their own organization.
Sure, I can. I try to avoid like being too UW healthy because I didn't want you to feel like I was trying to, but I am actually really proud of some of the work that we've been doing at UW Health around COVID-19. So for one, I have had the opportunity to sit on our incident command. And the reason I say that is not because of me, but because it's been, I think, it's great to see that the Chief Diversity Officer of the organization was designated to sit on the incident command. Because as all of you know me, I am no wallflower. So if I'm sitting in incident command, I am bringing up issues, right? I'm asking the question, who is being impacted, and trying to have a conversation around it. So that in itself, I think the fact that the high decision-making table is involving people who are really using this equity lens is really being very important for our organization. Second, we were probably one of the first organizations right out the door, March 16th, that week, in saying we need to make sure that we give additional resources to organizations led by a community of color that are working with the communities of color, because the impact of COVID-19 is going to be dramatic and immediate in our frontline workers who are working with the industries that right now this week have just shut down. And that was the week of March 16th. And by the end of that week, we got additional $300,000 in funding from immediately approved. And we immediately, by the end of that week, made a decision about where we were going to be investing that funding. And we were going to invest that funding. 170,000 of it went to the Latino Consortium for Action, and the rest of them were split. At that point, the Dane County collaboration of Black service providers was not up and running yet, but many of the organizations that are part of the Black service providers were the organizations that we decided to give funding to. Funding that is trust-based funding. Do what you need to be doing with that funding. We don't want a report back. We don't want you to tell us how you're spending it. We just want you to be able to serve the communities that you serve. So we immediately were able to do that. The other thing that we've done is that we've provided enormous amount of language access, which other organizations, which weren't being provided in many ways, for access to health and information immediately. Our hotline, COVID-19 hotline, was immediately recorded in Hmong and Spanish. The prompts allow you to get to pre-recorded information, so you can listen to them in Hmong and Spanish. And then all our staff that are responding to those to that hotline, which was getting thousands of calls the first few weeks, thousands. Were able to get an interpreter on the phone. We were able to immediately remotely set up kind of our interpreters through great technology that we were able to deploy, so that we never had a gap in our patients being able to have interpreter services available, even though it was remotely. Especially our COVID-19 positive patients, because again, think about being, no visitors allowed, you are limited English proficient, you're in the hospital with COVID-19. So like layers there. So we were able to do that. We also were able to really work in partnership with a lot of our, again, great partners and record videos that were messages for the community by people that are trusted in the community, and that could get that message out to the community. So my amazing friend and sister, Carla Gaines, who works at Courts, was able to record a number of messages for the African-American community that we were able to share in social media. We had a message in American Sign Language. We had messages in Spanish. So that was another piece of the work. And then last but not least, staying with our ears on the ground, like on a daily basis, kind of staying in touch with the grassroots leaders in communities of color, to hear back about what was going on and what people were hearing and what actions could we take as a healthcare, as a large healthcare system in meeting those needs. Some of those actions have been distributing. There is a box in my office, you can also sell it, but it's already, it's not yours, but it's going to be somebody's. So, whenever we've been able to get a hold of PPE masks that we are able to, again, give it to those who most need it. And so communities of color, are being able to get them in the hands of people that otherwise may not be able to get it. I know DMI received a list that we created also of suppliers of PPE that we thought was important to share with community. So all of those things are things that I think we've been trying to do within the UW Health. Had testing, availability of testing, making messaging around the fact that whether you have insurance or don't, it doesn't matter to us for you to come and get testing and to get treatment for COVID-19. So I think I rambled a whole bunch of different things, but busy. It's been a little busy.
Wow, thank you for honestly important leadership at UW Health. One last quick question, but I wanted to say before that, the list that you just mentioned of available PPE at different locations is on the DMI's COVID-19 resource page on our website. So please check that out. It's a great resource that Shiva was smart enough to come up with. So what's on to end today? What's one positive story from COVID-19 that gives you hope for the future?
One positive, I would say it's collaboration and the leadership in communities of color. And, I would say seeing how we have been able, and I'll just talk from my experience because I'm a member of Latino Consortium for Action. So it's just personal to me that the way that we've come together as a group that has been meeting for a long time before that, and we're all good friends and colleagues, but the way that we have come together and been able to respond to the needs, to work together, to overcome our own, I think, to not overcome, but to also have a space for our own needs and our own stressors, and be able to share that space both collectively as a group of people who are serving the community, and at the same time being able to really do that effectively has been really enormously, I guess, inspiring to me. And And the other thing that's been inspiring to me, honestly, I have been here working very long hours at UW Halls, oftentimes, 8, 9 o'clock. And the environmental services ladies that comes into my office around 7:30 p.m. and the smile on her face.
That is an awesome way to end. Shiva, from all of us at DMI, we cannot thank you enough.
Behind the mask, by the way, smile on her face behind the mask, just so somebody doesn't go say that she was not wearing a mask. She's wearing a mask, but I can tell. Now we can all, I think, tell when somebody's smiling even with a mask on.
Oh yeah, absolutely, absolutely. Well, honestly, from all of us at DMI, we cannot thank you enough, Shiva, for your incredible leadership, not only at UW Health, but at the City of Madison. So thank you very much.
Thank you, everybody, for joining me today. And let's keep disrupting.
We will. And thank you so much again. We hope to see you at another event soon. Hope everyone has a good and positive and fruitful long holiday weekend. Thank you for everyone. Thank you again, Shiva.